Welcome to our discussion on the rising incidence of New Delhi metallo-beta-lactamase producing carbapenem-resistant enterobacteriales. This analysis spans 2018 to 2023, conducted across 10 United States sites, and is published in Open Forum Infectious Diseases by Duffy et al. Carbapenem-resistant enterobacteriales, CRE, pose a critical threat in antimicrobial resistance. In 2022, 13,387 CRE infections were reported in United States hospitals. The rise of New Delhi metallo-beta-lactamase, challenging Klebsiella pneumoniae carbapenemase's dominance, limits treatment options. Cefiderocol and Aztreonam avibactam are the last reliable treatments for New Delhi metallo-beta-lactamase CRE. New Delhi metallo-beta-lactamase hydrolyzes carbapenems at its sync-coordinated active site, evading conventional inhibitors. The NDM gene on mobile genetic elements spreads rapidly. New Delhi metallo-beta-lactamase strains often carry additional resistance mechanisms, posing a threat to cefiderocol and Aztreonam avibactam. Our study utilized a population-based active surveillance across 10 centers for disease control and prevention, emerging infections program sites covering 43 counties with 23.2 million people. We defined cases by isolating carbapenem-resistant Escherichia coli, Enterobacter, or Klebsiella. Classification distinguished healthcare-associated from community-associated cases. Molecular characterization involved real-time polymerase chain reaction and whole genome sequencing. Statistical analysis included Mann-Kendall trend tests and logistic regression. The overall carbapenem-resistant Enterobacteriaceae incidence has significantly increased by 43% from 2018 to 2023, with a notable rise in New Delhi metallo-beta-lactamase carbapenem-resistant Enterobacteriaceae cases, showing a 9.4-fold increase. This trend is statistically significant, with a p-value of 0.02. Interestingly, New Delhi metallo-beta-lactamase carbapenem-resistant Enterobacteriaceae is nearing the incidence of Klebsiella pneumoniae carbapenem-resistant Enterobacteriaceae, marking a historic shift in the United States carbapenemase landscape. In analyzing 8,421 carbapenem-resistant Enterobacteriaceae cases from 2018 to 2023, significant differences emerged between New Delhi metallo-beta-lactamase producing carbapenem-resistant Enterobacteriaceae and Klebsiella pneumoniae carbapenemase producing carbapenem-resistant Enterobacteriaceae groups. New Delhi metallo-beta-lactamase producing carbapenem-resistant Enterobacteriaceae cases were younger, predominantly E. coli, and more community-associated. In contrast, Klebsiella pneumoniae carbapenemase producing carbapenem-resistant Enterobacteriaceae cases had higher comorbidity and healthcare exposure. Mortality rates were similar, but healthcare exposure and organism type varied significantly. Multivariable analysis reveals Escherichia coli as the strongest predictor for New Delhi metallo-beta-lactamase producing carbapenem-resistant Enterobacteriaceae, with an adjusted odds ratio of 10.2. Young patients and community-associated cases are significantly overrepresented. Notably, there's a 40% annual increase in the odds of a carbapenem-resistant Enterobacteriaceae case being New Delhi metallo-beta-lactamase producing, highlighting a concerning trend. From 2019 to 2023, international travel emerged as a significant risk factor for New Delhi metallo-beta-lactamase producing carbapenem-resistant Enterobacteriaceae. India was the top destination, linked to 42.5% of cases, highlighting its role as a New Delhi metallo-beta-lactamase epicenter. Mexico and El Salvador followed. Notably, 40% of community-associated cases had no travel history, indicating local transmission. Whole genome sequencing from 2018 to 2022 reveals distinct patterns in New Delhi metallo-beta-lactamase producing carbapenem-resistant Enterobacteriaceae and Klebsiella pneumoniae carbapenemase-producing carbapenem-resistant Enterobacteriaceae. Klebsiella pneumoniae carbapenemase-producing carbapenem-resistant Enterobacteriaceae shows clonal spread, while New Delhi metallo-beta-lactamase-producing carbapenem-resistant Enterobacteriaceae exhibits expanding genomic diversity due to horizontal gene transfer. Notably, New Delhi metallo-beta-lactamase-producing Escherichia coli, ST167, and ST405 are high-risk clones with significant transmission potential linked to increased in-hospital mortality in severe cases. The treatment landscape for New Delhi metallo-beta-lactamase carbapenem-resistant Enterobacteriaceae is severely limited. Ceftazidime avibactam, meropenem vaborbactam, and imipenem relebactam are ineffective against New Delhi metallo-beta-lactamases. Cefiderocol and aztreonam avibactam face resistance challenges. The emergence of BLA New Delhi metallo-beta-lactamase with penicillin-binding protein mutations and AMP-C beta-lactamases may lead to pan-resistant phenotypes, complicating treatment strategies. The study's strengths include geographic diversity across 10 emerging infections program sites and a high carbapenemase testing rate, enhancing data reliability. However, limitations exist in generalizability and specimen exclusions, potentially underestimating carbapenem-resistant Enterobacteriaceae incidence. Missing travel data and incomplete whole genome sequencing data further limit comprehensive analysis. The incidence of carbapenem-resistant Enterobacteriaceae has risen significantly, driven primarily by New Delhi metallo-beta-lactamase-producing carbapenem-resistant Enterobacteriaceae, which is increasingly community-associated. Younger patients are disproportionately affected, with Escherichia coli as the predominant pathogen. High-risk clones like New Delhi metallo-beta-lactamase-producing Escherichia coli sequence type 167 and sequence type 405 are expanding. Treatment options are critically limited, necessitating urgent adaptation in surveillance and therapy guidance.